Hi, welcome to the Power of Care Spotlight. I'm Larry Moliterno with Meridian Community Care, and we're here today with Dr. Rachel Hoffman, who is Meridian's Director of Adult Residential Services. Thanks for being here, Rachel, first of all. One of the things that we want to talk about today is just the uniqueness of working with the women and some of the gender-specific challenges that come with that.
Absolutely. Addressing gender is very important in treatment. We know that there are a lot of unique dynamics that come into play whether you're working with men or women. And so it's important for us to approach that process by looking at what those gender specifics might affect, how they might affect treatment.
And we know that a lot of the women that we see have had some trauma in their life. When we talk about trauma, what kind of incidents are we talking about?
Trauma is going to be anything that the person experienced where they had a very negative reaction. A trauma can be anything from witnessing a car accident to being part of a natural disaster to events that are a little bit more personal, such as rape, sexual assault, things of that nature. So when we say trauma, it's really more about something very frightful that happened to a person and then their reaction to that thing that happened.
So how do we deal with that trauma issue at the same time that we're dealing with the addiction?
Well, it's very important that we do. Research continually tells us that if we ignore one of those issues, if we just focus on the addiction or if we just focus on the trauma, that we're missing treating the whole person. And so one of the things that we've been very focused on doing here at Meridian Community Care is looking at how we can treat both of those issues together. And that's through a combination of counseling, case management services, but the focus is really on helping the whole person.
And this can be done in a number of different settings. I know that you're responsible for overseeing not only our short-term residential, but our transitional, longer-term transitional, and to some folks, even more long-term. We can have some of our clients here for a number of years receiving the support services, and a lot of times it's not just for the addiction, but also dealing with those trauma issues. Absolutely.
We're very fortunate here at Meridian that we have a continuum of services where we can treat the person short-term if that's what they need, or we can provide longer-term services and treatment to them as well. And absolutely, the treatment from trauma can be more of a lifelong process. But the good news is that people do tend to recover very well from trauma and addiction with the right treatment.
That's great. And I think if folks want more information on how trauma affects the treatment process, especially with women, they can get a hold of us at meridiancommunitycare.org. Rachel, thank you so much for being here today.
Thanks.